Hello and welcome to this episode of the Savvy NP. Today we will be discussing Fragile X syndrome. Fragile X syndrome is a genetic disorder. It's fairly common. It occurs in about 1 in 4,000 males and approximately 1 in 8,000 females. So that does make it the most common chromosomal disorder for males that leads to cognitive problems. So I want to talk about that today and how it is transmitted. It is actually transmitted by a mutation that occurs in the FMR1 gene. And this gene is responsible for making proteins. These proteins are what helps with normal brain development. So it just kind of works all in a line. If that gene is not working properly, then the protein won't be made and then the child will not have normal brain function. So this gene, what happens is it has a repeat sequence of the CGG in the DNA. The CGG sequence, if that is repeated enough times in a row, that's when the mutation occurs, and that's called expansion. If that repeated sequence only happens 5 to 40 times in a row, then there will still be normal manifestation of brain development in the child. But if it expands and it occurs up to 200 times in a row, then we start to have the symptoms, and that is diagnosable as FXS. So some symptoms of this are, first and foremost, we see some developmental delays in the child. Maybe they're not walking, talking, or sitting up at the same rate as other children their age. They may have learning disabilities, have a difficult time learning to read or understanding concepts, and also some social problems are common with FXS. They may have anxiety or difficulty making eye contact. But anyway, so how this occurs is I talked a little bit about that repeat sequence in the DNA line of C, G, G. That would be one sequence. And then seeing this again, C, G, G, there's two. If this is made with that sequence being repeated greater than 200 times, then that equals a diagnosis of Fragile X syndrome. And this expansion occurs primarily in the ova. It can occur in males as well, but typically doesn't reach over 200 when it expands, only in the ova. So we see this more common, this expansion in females, and it gets passed on through that line. Now I want to kind of go over a case study here and show you in a real life situation how this would occur. And here you see a family. We have Adam as the grandfather here. Adam originally had 3 children. He had 2 females, Beverly and Bonnie, and then a male named Brian. None of them had any symptoms of FXS until we see here in the grandchild, Charlie, a male. He had some developmental delays. Nobody knew why, but he just wasn't performing at the same level as other children his age. So happened when Beverly was pregnant with her first child, she had an amniocentesis done. And that showed a normal DNA in her child. It was a female that was normal. But the blood work for the DNA did show in Beverly that she was a pre-mutation carrier of FXS. So what that means is that expansion has occurred in the ova here. And she now has between 50 and 200 repeat CGG sequences in that FMR gene. And she is a pre-mutation carrier because of that. That is what the amniocentesis showed. So we know that as a fact here. So what that tells us is that she has inherited that X-linked gene from her father, Adam. Somewhere on that X that she got from her father, there is this mutation that we see here. Now, because Bonnie also has a child with expansion here all the way greater than 1,000, we know she is for sure an obligate carrier. anytime you are a carrier, even though you don't have symptoms, every child is going to have a 50% chance of inheriting that X from mom that's going to carry the diseased portion. One X will come from mom and one X will come from dad if it's a female. If it's a male, the X will come from mom and the Y will come from dad. Which is actually what occurred over here. So we know that Bonnie's children will all have a 50% chance of inheriting this. Beverly's children will have a 50% chance of inheriting this. They will get one of the X genes from mom, 50% chance. If it's the normal one, or do they get the 50% chance of getting the diseased one? 50% in all these children. What about Brian? What is his risk of being a carrier here? Well, we know that boys inherit their Y gene from their father. They do not get an X gene from mom. Boys always get their X gene from their mom and their Y gene from their dad. So he got Y from dad. This is an X-linked disorder. That's what Fragile X syndrome stands for, the X. So because he is only inheriting that Y gene, there is a 0% chance that Brian will inherit this from Adam. So that answers a few questions to do with this case study. 50% chance for the children of Bonnie and Beverly, 0% chance that Brian or his children will inherit this. Let's talk about Adam here, the grandfather. Why does he not have symptoms, but he's so involved in this whole case? It's because that repeat sequencing is less than 40 repeats. So he is actually going to be called a normal transmitting male. And when you see this pattern, this typically occurs in a grandfather. Gets passed down to the daughters who pass it down, and it's often first recognized in this grandson who has symptoms. Well, I hope this has helped you understand this somewhat complicated transmission pattern of Fragile X syndrome. Hope it helps you in your practice to recognize these patterns and be able to educate your patients on how to get tested for DNA, to see these repeat sequences, as well as how to calculate risks for patients and their subsequent generations. What's the chance that their children or their children's children will have this, and to what degree will they express the symptoms of FXS? Thanks for tuning in. Hope to see you next time on the Savvy NP.